Alrighty, today's Lunch and Learn session 17 is on physical activity and function with Dr. Dominique Kinnett Hopkins. Really quickly, my name is Tiffany and I'm a study coordinator for the Health Equity Core. We are a group within the Chronic Pain and Fatigue Research Center that focuses on elevating the voices of patient communities in research in order to raise awareness about different health inequities and community needs. So together, myself, our director Rachel, and our project manager Vivian work to bring events like this to the community. I'm here with Megan today, who will be helping me monitor the chat. So for our online attendees, feel free to submit any questions that you might have in that chat or raise your hand to be unmuted and contribute to the group discussion. The Health Equity Core is part of the Chronic Pain and Fatigue Research Center, or CPFRC for short. The CPFRC at the University of Michigan is a world-renowned research center composed of investigators and clinicians who study the mechanisms and most effective treatments for chronic pain and fatigue, including conditions that have chronic pain and fatigue as core symptoms. And we aim to do a couple of different things. For example, we improve the understanding and management of chronic pain conditions, and we also provide current evidence-based information to the public. We don't only study folks with diagnosed pain conditions. Instead, we are interested in anyone that's experiencing chronic pain. And with that, please welcome Dr. Dominique Kinnett Hopkins.
Thank you so much, Tiffany. Let me go ahead and get settled here. Okay, are you able to see my full slide in presentation view?
Yes.
Wonderful. Okay, hi everyone. I am Dr. Dominique Kinnett Hopkins, and I'm an assistant professor in the School of Kinesiology at the University of Michigan. And I also direct the Translational Physical Activity Laboratory here at the School of Kines. And I'm really excited today to talk to you about a passion of mine, which is physical activity and function within lupus. Okay, so there's an adage that's become common in the health world, and that is if there was a pill that could reduce fatigue, ease joint pain, improve sleep, lift up your mood, and support long-term heart and brain health, we'd all likely be taking it. And the person who invented it would be very wealthy. But unfortunately, that pill doesn't exist, but exercise does. And when done consistently, its benefits are remarkably similar to those of this magic medication. For individuals living with lupus, that does not mean high-intensity workouts are pushing through pain. In fact, the most important aspect to movement in lupus is that it's sustainable, it's gentle, and it's responsive to your body signals. And so while exercise won't likely replace medication, the evidence is clear that physical activity can play a meaningful role in management of symptoms, supporting physical function, and improving quality of life. So today I'd like to go through a few objectives. I'd like to understand how physical activity can help support symptom management and the quality of life in lupus, review national guidelines for physical activity and lupus-specific considerations, address common concerns about physical activity in lupus that I often hear from my role in our exercise studies, and different things that I can maybe address that would help you feel more inclined to participate in exercise. And then explore an example of exercise program that we deliver in our lab for those who might be interested in how to start off. I do have a question, Tiffany. I know there are a few in the room. What are people's backgrounds and familiarity with exercise? Is it something that people currently engage with?
Yeah, that's a great question, Dom. Is anyone willing to share? Okay. I see. Yeah, we have someone in the room that has MS and engages in low activity.
Well, that's interesting. So my other condition that I work with, I primarily work with multiple sclerosis and lupus. And so a lot of what I'm sharing today are strategies for both conditions. So thank you so much for sharing that. Julie, I saw that you unmuted. Did you have something?
Yes, I have lupus, multiple sclerosis, and myasthenia gravis.
Okay.
So I used to be a weightlifter, taekwondo, heavy, etc., taekwondo, aerobic bunny. But now I do yoga, primarily slow flow and like a few positions for the whole hour. And then I do some limited walking and stretching, and I get a lot out of that, just doing that and enjoying nature.
Oh, that's wonderful. Well, thank you so much for sharing that with me. And it's really helpful to also understand that there are some people with MS in the room, because it is actually where I started my research too. So I'm excited to be able to tailor this a little bit for that. Um, all right. So from engaging in exercise, it seems like we are familiar with some of the benefits that it can provide. We do see decreases in things like fatigue, anxiety, pain, depression, inflammation, and really importantly, cardiovascular disease risk. For those who have lupus, there's some evidence to support a 50% increased likelihood of developing cardiovascular disease. And so to the degree that we can engage in physical activity to help mitigate some of that risk is really important. Some of the other benefits that we see are improvements in physical function and aerobic capacity, being able to maintain or gain muscle strength and joint flexibility, improving our sleep quality and mood and overall quality of life. And so I hope that this helps with the buy-in and that, expression of it being this magic pill, because there are so many great benefits that we do see from those who can consistently engage in physical activity. I do think there are important parts that we should define related to physical activity and exercise. We often use them interchangeably, but they are quite different, and that distinction is important. So physical activity is any body movement that we do that contracts skeletal muscles and increases energy expenditure above resting levels. Whereas exercise is a subtype of physical activity. It's planned, structured, repetitive, and it's performed with the goal of maintaining or improving physical fitness. And so when we think of different activities that fall in the category of, we think of different activities that fall under physical activity, we can include things like household chores, gardening, using a standing desk, things you do associated with your job, and walking the dog, what we categorize as slow walking. Or if you're my dog, I go on a sniff walk. So I take 2 steps and then I'm there for 5 minutes before we can continue moving. Whereas with exercise, we have things like brisk walking, biking, cycling, water aerobics or aerobic dancing, yoga, as was mentioned, Pilates, and strength training. And so I show this to show the distinction between the guidelines I shared today are physical activity guidelines. If you do exercise, it counts towards those guidelines, but there are other things that you can do that are less intense, that provide really great health benefits. And so it's important to not say, well, I can't do an hour of the Zumba class, so therefore I'm just not going to exercise. We really want to, or I'm not going to do any physical activity today. We really want to take consideration of all the ways we can incorporate more movement into our days. So there are different types of activities. There's aerobic. That's what we kind of stereotypically think of, right? We get your heart pumping, we breathe faster. This is walking and swimming. We have strength training, where it makes your muscles stronger by lifting weights or using some sort of resistance. And that resistance can be bands. It could be your own body weight. We also have things like flexibility, and this helps muscles and joints move more easily by gently stretching them. And then balance. These are the exercises that we do to be able to stay steady and hopefully prevent falls. It's really important that when we talk about physical activity and exercise, that we also think about sedentary behavior. And this is a behavior that refers to anything that we do when we're awake that's done while sitting or lying down, and it uses very little energy. These are things like working at a computer, watching television, or scrolling on your phone before you go to bed at night. Those are sedentary behaviors. And for people with lupus or MS, this is something that can be very complex. Fatigue, pain, joint stiffness, spasticity often lead to needing longer periods of rest, and understandably so. But research suggests that prolonged sedentary time can contribute to worse outcomes. This is things like, I'm feeling fatigued, so I'm sedentary, but now I'm even more fatigued because I've now been engaging in prolonged sitting. This can increase cardiovascular disease risk and deconditioning over time. And so it's really important that we think about interrupting that sedentary time, which doesn't necessarily mean that we're exercising more. It can be as simple as taking short movement breaks and standing up, stretching, going for a walk, a lap around your house or apartment every half hour for a few minutes. those small adjustments can make meaningful differences in how you feel. And the goal here is not perfection, right? Like it's not reasonable in this day and age to not be sitting down. Often it's how our lives are kind of situated. But recognizing that when we've been still for too long and gently inviting the body to move is a powerful act of self-care and can really make a big difference down the line. Okay, now I'd like to talk about the physical activity guidelines. And so there are guidelines that were developed for people who have chronic conditions. And so you can understand that this is pretty general, right? There are lots of different chronic conditions, and they are similar to that of the general population as well. It's 150 minutes of moderate intensity aerobic activity every week, and 2 days per week of muscle strengthening activities that target all major muscle groups. And so when you think of that 150 minutes, it used to be that any exercise bout or period of time that was less than 10 minutes of moderate intensity aerobic exercise was not counted, right? You had to have at least 10 minutes to count towards that 150 minutes. But research has actually shown that that's not a good benchmark. That's not how we should be thinking about movement. And so even if done for a minute, those small efforts compound. And so I like to think of it as within a week's time, I'm working towards 150 minutes. That could be 5 minutes when I wake up in the morning, 10 minutes over lunch, 5 minutes in the evening. However I spread that out, I want to work towards that overall. What I think is really important is to clarify what is moderate intensity and making sure that we kind of are checking in with our bodies to know if we're exercising at the appropriate intensity. This is a scale we call the rate of perceived exertion scale. It's a modified version. So the original scale goes from 6 to 20, and it correlates with heart rate. So 60 beats per minute or 200 beats per minute is equivalent here to what we have as 1 to 10. And so 1 is something that we're all pretty much doing now, right? Very light activity, anything other than sleeping. We're sitting here, we're watching me on TV and we're driving. Those types of activities are very light. Then we have light activity, which feels like you could continue this for a long time. It's easy to breathe, it's easy to talk, you're having no problems. Moderate activity is the goal, this rating of 4 to 6. So I said, if I asked you, how hard are you working right now? If you said, I'm at a 4, a 5, or a 6, we would consider that moderate activity. And that's really where we hope that you are in the range that you want to be in while you're striving to reaching those physical activity recommendations. This is described as breathing heavily, but you can still hold a short conversation. And if you're doing strengthening exercises, the last repetition of that is still pretty easy to do. You're not lifting a weight that's so heavy that by the last one, you can't keep going. This is really important to also understand what vigorous activity is, so you know when you're maybe pushing yourself too much. Vigorous activity, a rating of 7 or 8, almost feels uncomfortable, right? It's heavy, you're heavy breathing, you can barely speak a sentence. That last repetition when we're doing strengthening exercise is clearly more difficult than the others. That's an indication that maybe I'm working a little bit too hard for what's good for my body at this stage. And anything further than that, very hard or maximal effort activity, these are things that are significantly difficult to do, where you're breathing and you can barely speak, and trying to lift that weight one last time is nearly impossible. Those are ranges that I would caution you to stay pretty far away from, because the goal is that magic green area of moderate activity. I'm breathing heavily, but I can talk to you. The last repetition feels similar to how my first one went. Okay, so that's in general for people with chronic conditions, right? I was part of an international task force. There was 27 of us researchers where we worked to come up with activity recommendations specific to lupus. Now, I will say here, just because it was stated that there are a few people with MS in the room, there's a lot more research around exercise and its safety and benefits, and guidelines specific for MS. And so what I will say there is that recommendations are 2 to 3 times per week of aerobic activity at 20 to 30 minutes. And for strengthening exercises, it's also 2 times a week for large muscle groups. For lupus, we do see that broader, right? 150 minutes general guideline. And that's something that my lab is currently working to strive to change, right? We want to be able to bring more specificity to how much movement is necessary for the health benefits, and kind of where's the sweet spot between pushing myself too far and not. And that's why it's very individualized is how we like to prescribe. But just to give some context for those who also have MS, those guidelines we see are a little bit less movement than in general. Okay, now back to the International Task Force. There were 15 total recommendations that the 27 of us researchers voted on and developed. And while there are a lot of different ones that talk about different syndromes or manifestations of different symptoms that might need to be considered with a provider, these are the 5 that I find to be the most important to take away. That QR code does link you to that article if you are interested in looking at that later. Everyone with lupus should engage in physical activity and exercise. There was a period of time for both MS and lupus where we found that providers, as soon as you were diagnosed, were like, okay, don't move. It will hurt you will exacerbate your lupus. You will, encourage a flare. And that's just not true. The evidence does not suggest that at all. And so everyone should move their bodies to the degree that they can. Exercise should be personalized and adopted gradually. And so this isn't, one of those instances where we recommend a New Year's resolution type of thing where I went from not being active and then tomorrow I'm going to do an hour of exercise. That may not be the best approach, and is not, evidence doesn't support that helps gather long-term behavior change. And so we want to think about personalized and adopting new behaviors gradually. And so this might be starting with 5 minutes a couple of times a week and slowly building up from there. We then think about modifications due to symptoms or flares. It should be taken. Within living with a chronic condition, there's change day to day, but there's also change within day, right? There's a lot of variability about how symptoms are experienced. And just because you had it plan to do an exercise session that evening, if you notice you're experiencing a lot of joint pain, maybe we do think about doing it the next day. Maybe instead of it being moderate intensity, I'm able to do light activity for this session, and just really making those modifications so that we are considering how we're feeling. Each session should include a warm-up and a cool-down. And so when you're doing strengthening exercises and you're planning to use weights, maybe you do some of those range of motion and those movements without the weights to warm up the body. If you plan on going on a moderate intensity walk, maybe you do a light walk for a few minutes while you get yourself in that mindset and in that your body ready for that exercise. And then finally, discussions with medical professionals are strongly encouraged. I'm able today to talk to you about general recommendations, but your healthcare provider and your team knows the different things that you're going through right now and the different ways that lupus might impact you. And so it would be really encouraging you, I'm really encouraging you to have that conversation with your medical professionals and ask your rheumatologist and your primary care provider what they think about exercise and if they have recommendations specific to you and the ways that lupus manifests for you. All right. Now the fun part, what gets in the way of exercise? So in general, there are a lot of barriers to exercise. We are all busy. We have a lack of time, being tired, lack of access, right? Maybe there are places we can't go, or if they are, they're too expensive. And also just not necessarily knowing where to start. And then we think specific to lupus, we have lupus fatigue, right? We have joint pain, we have sun sensitivity, those different types of symptoms that can impact our ability to engage in physical activity. There was a systematic review done a couple of years ago now, and a systematic review is a study that summarizes the results of multiple studies. It's kind of a great resource. So when different investigators have conducted research studies, you only have the results of that one project, but a systematic review combines them all and gives you a summary. So it's really helpful for high-level knowledge. Unfortunately, there were only 3 studies that had been done related to physical activity and function in lupus. And so that means there's a lot that we don't know. And the results of those studies were very mixed. In some instances, they saw that people with lupus had no differences in their function compared to people without lupus. In other populations and other studies, they saw that there were differences. And so this is work that we are currently trying to solve to be able to provide more personalized care. There was a qualitative study that interviewed people about their thoughts on physical activity. And one of the most prominent barriers to engaging in physical activity was fear. This idea of getting injured during exercise and not being sure how to make modification. Is it safe? Everyone agreed that physical activity would be good if it was managed appropriately, but how do I know if I'm managing it appropriately? And so that's something that we want to think about, and having that education and making sure we're taking it at a gradual pace so that we don't accidentally injure ourselves. And then another qualitative study in chronic conditions that we found is this idea of judgment. A lot of symptoms are invisible to others. And with autoimmune conditions, there are fears on engaging in physical activity when you do have the capacity, because it might set the wrong expectation. Maybe grace won't be extended on times when you can't participate, even though you can today, whether that's a child in your life or a family member or a friend. The saying is, well, you were able to do it last time. Well, last time's not today, and I can't go with you on that hike today, right? So there are some people who limit their engagement in movement because of fear of what it might bring in terms of expectations. And that's something that we really want to have open dialogue around the people in our lives to say, hey, this is just how variable lupus symptoms are. And it's important that I don't feel an obligation to engage in things when I can't, but I also don't want to be discouraged from engaging in them when I can. Okay. Some of the common questions that I get related to engaging in exercise for people with chronic conditions is, how do I know if the soreness I'm feeling is normal? And so there's something called DOMS, for short, delayed onset muscle soreness. And this is what we expect after engaging in a strengthening exercise session, right? So if I decided to do a few squats or lunges or a wall sit, and then 2 days later, my front of my legs and the back of my legs are really sore, we would attribute this to delayed onset muscle soreness. This is what I would categorize as normal. If you did those exercises and all of a sudden your back or your arms hurt, that would be different, right? Those aren't the areas you targeted, and therefore it may not be associated with what we would define as normal. If you're having a flare or a mild high pain day, opt for mild exercise or rest. Not everything has to be done 100%. Something is better than nothing. And so being in gentle movement or slow yoga, as was described as a way to engage in physical activity, is a great option. And when in doubt, and if you experience any increase in pain, especially if it's consistent, stop and check in with a healthcare professional. It is just not worth leaving things to chance, and really always want to advocate for yourself and making sure that you are getting the best care possible. Another question I get is, what does listen to your body mean? And it's usually with some frustration. A lot of times I think that we say this, but we don't explain it well. And so I mentioned earlier, there's the variability within day and between days. And so recognizing that when you wake up in that morning, or when you are going through your day, you're noticing that your symptoms are changing. And that means your limits might be changing. And so your expectations of yourself when you engage in physical activity should account for that. And so another great way to learn how to listen to your body is monitoring your symptoms before, during, and after exercise. A couple minutes before you start your physical activity, say, how do I feel? How's my mood? How's my pain? How's my brain fog? How am I in general? During your exercise, check in. How are those things? After your exercise, how's my fatigue? How's my pain level? How's my mood? And what you'll learn is, if you do that gentle check-in with yourself for the course of 2 weeks, you'll figure out what your normal is before, during, and after. And then when there's variation from that after engaging in a new type of activity or even the same one, you'll know that, hey, I need to be paying more attention. Things aren't kind of normal for me. You also want to avoid a push-through mentality, right? We don't want to just, because I said I was going to do this thing, push through. This is not an area of your life that expects you to be at 100% all the time, right? 5%, if you only have 5% to give, that's 100%. And so that's where we really want to change the narrative on this all or nothing approach with physical activity and exercise. So be flexible with your routine and allow yourself the grace of changing days, changing times, changing intensity, with the long-term goal in mind. I am trying to adopt a behavior of more movement. I want to live a life that allows me to be moving my body more in whatever way that I can. It's not about, today's goal has to be met perfectly. It's, am I on track to my long-term goal? And then the final question I'd like to share is, how can you support someone adopting an exercise program? And this can be for yourself, like, how do I support myself through this? Or how do I support someone else? And having accountability partners or an accountability checklist works. I don't know if anybody remembers those chore charts, right? But it was like nice to put a gold star when I did the dishes or, took the dog for a walk. And so those types of ways of holding yourself accountable are really great. And you want to celebrate all wins. It doesn't matter if it's not reaching the ideal that you hope for and that you're striving to for one day. Appreciate what your body is able to do today and celebrate those small wins. Again, I can't overemphasize this, is being flexible and adaptive, and encourage pacing and rest, right? So learning how to listen to your body, and then support autonomy, right? So if you're able to do things, do them. If you're not able to, don't do them, and don't let any shame or guilt kind of interfere with that. The final thing I wanted to share with you today is how we think about progressing exercise for one of our studies. And so, we have a lot of information in the research world on the benefits of exercise and physical activity for people with lupus. I have a version of this program that's tailored specifically for MS, and it's called Prompt instead of Pedal. But the idea is that we want to progress through different levels. So for aerobic activity, it's 150 minutes of moderate physical activity per week. And this program is a 6-month intervention where, in an ideal world, as soon as you receive your diagnosis, you're referred to physical therapy, not for the same reasons you would be if you hurt your back or your knee, but to learn how to exercise. And so this is a low dose model of physical therapy where you go for 6 visits over the course of 6 months to learn how to exercise. And we have goals for week 1, 6, and 10 for aerobic activity of where we hope to work towards. But because it's a 6-month program, we have up to 24 weeks to personalize the progression to help people reach those guidelines. And so for level 1, and what I would recommend for people who are starting off a new journey, is to think about doing aerobic activity like walking, 5 to 20 minutes at moderate intensity, 2 to 3 days per week. And you do that until you've adopted that habit and you've worked your way to 20 minutes. Then we think about bumping to level 2, which is at 25 to 35 minutes. Again, 2 to 3 days per week. And then when you're ready and that's become a consistent part of your routine, we'd bump up to level 3, which is at 40 to 50 minutes. Now, if that sounds like a lot, remember 150 minutes over the course of a week. Maybe it is better for you to stay at a max of 30 minutes, but you're doing that 5 days per week. And so that's where some of that individual tailoring and thinking about other, competing interests for your time come into play. Related to strength training, we think about doing major muscle groups a few times a week. And so at the beginning, you do 2 sessions of at least 15 minutes of active engagement and strengthening exercises with more higher repetitions and lightweight and fewer exercises. So we recommend people pick 5 exercises that they do. They do those exercises 15 to 20 times each, and that session should take about 15 minutes, and you should have a little bit of a break to recover in between each exercise. As you move through the program to level 2, we recommend doing 2 to 3 sessions of at least 25 minutes of strengthening exercises. And this, we increase from 5 to 7 exercises, and we decrease how many times we do them, and we do those for 12 to 15 repetitions. And then finally, for level 3, we work our way up to 3 sessions of at least 30 minutes of active engagement and strengthening exercises. We only do 8 to 10 repetitions, thinking that maybe the resistance weight that we use is a little bit higher, and we have up to 10 exercises that we recommend, again, with that 2 to 4 minutes of rest in between each exercise. So the final thing I want to do is wrap this up with a nice bow, and that is that physical activity and exercise are important health behaviors for everyone to engage in. Adopting exercise should be done in a gradual manner and with involvement of your healthcare team. and caregivers can provide great support. And so we want to think about the people in your life who can be accountability partners, the ways you can be accountable to yourself to help support the adoption of these behaviors to maintain your function and improve your overall symptom management. Thank you so much. I'm happy to take any questions.